Nigeria, particularly in the north, child mortality rates remain alarmingly high. To address this pressing issue, the Child Health and Mortality Prevention Surveillance CHAMPS project, funded by the Bill and Melinda Gates Foundation and introduced by Emory University, is working tirelessly to identify and tackle the root causes of child mortality.
Emory University collaborate with high-profile and reputable universities in those countries with high rate of mortality. And in Nigeria, it is 2 universities that were selected. ATBU, Trough University, was selected from the north, and University of Calabar from the south. And the project is both implemented in the College of Medical Sciences because it is a
CHAMPS uses innovative approaches like minimally invasive tissue sampling (MITS) and cutting-edge diagnostic to investigate causes of stillbirths and child deaths. By providing accurate data, CHAMPS empowers policymakers to make informed decisions, ultimately saving lives.
There's need to supplement the effort of the states and nations in Africa to see how that problem can be identified, with the aim that if the problem is the actual and the definite causes of that mortality is identified, then it means the data will inform the policy makers, alongside also to encourage and call for an intervention toward addressing that particular problem.
11 countries are involved, and Nigeria joined the project 2 years ago. Here in Bauchi, we have started, just like I said, 2 years ago, along with Calabar. So we have 2 sites in the country. The major aim is actually to use evidence-based data that is generated through the project for ultimate reduction in child mortality rates in our country.
As custodians of information, journalists play a vital role in promoting childbirth through media advocacy. This capacity building workshop, organized by the College of Medical Science of Tafawa Balewa University, equips journalists with the knowledge and skills to effectively report on child mortality issues.
When the problem is identified, it means it calls for a multiple hands toward addressing the problem. And it was on that background that the media was brought into the activity. And the aim of putting all these media together in one platform is to see how we can collaborate so that we can educate people on what may likely be the potential discoveries that will be discovered after the investigation.
For us to actually publicize that data that we have is something we would need the services of journalists, especially reaching out to the generality of the populace. If we want to reach the public, the best way and the best means, of course, is to utilize the skills and knowledge of journalists.
The National Health Demographic Survey of 2023-2024 reveals unfavorable under-5 mortality rates in Nigeria, particularly in the north. CHAMPS aims to reduce child mortality by identifying causes of stillbirths and child deaths, providing data-driven insights for policymakers, promoting community-centered interventions, and enhancing operational efficiency for network excellence.
So we want to join hands with all the other stakeholders, the government, and every other stakeholder that is interested in reducing those numbers. So that is actually the main aim. But the unique thing about CHAMPS is that we are utilizing a unique and special means of detecting precisely the cause of death in children.
Through collaborative efforts between stakeholders, including journalists, policymakers, and healthcare professionals, child mortality rate can be reduced in Nigeria.
You know what makes this training different is you are seeing people coming from the academia, especially the medical experts, coming to interpret and to rub minds with the journalists. So it is something that usually don't happen, but they coming out to interpret the survey they are taking, the surveillance they are conducting, and looking at reasons why we have high rate of neonatal, infant, and child mortality in Bauchi State. It's something that is very encouraging because it gives the journalists the opportunity to clearly understand what is happening.
By promoting child health through media advocacy, a healthier future can also be created for the Nigerian children. From Bauchi State, Muhammad Awal, Reporting for Correspondents Watch TV.